Hello, my name is Tosin Omolaja, and you're welcome to NAFDAC and your else, where we bring you all the important information you need to know about NAFDAC, the agency saddled with the responsibility of safeguarding our health by ensuring that the foods, drugs, cosmetics, and medical equipment made available to us are safe and wholesome. On this edition of the program, we take a bird's eye view of reforms that are transforming the quality service delivery and other regulatory and enforcement activities of the agency in ensuring the country is safe and free from substandard and unwholesome products.
Mid-2018, it used to be all central, meaning, central, Abuja, Lagos still have to approve. But because we now have directors in the zones, we decentralized so that the approval of foods can now be done at the zonal level. They don't need to send it to the director in Lagos to approve because we now have directors in the zones. The Lagos State Office was created because of the size of Lagos. EFSAN itself, the core office, does a lot of food approvals and so on, but we separated many of the items for Lagos State Office to take care of. So based on the size of Lagos, that office is very, very busy. That is the LSO office. So now it is not just that you can register at the zones. Now we have a Lagos State Office aside from the central office in Isolo.
Apart from decentralization of activities, the agency has also created the reform units for easy flow of communication so people can get quality service as well as also help improve the operations of the agency.
Basically, in reforms unit, we have 3 sub-units. We have the Servicom unit, which is also our customer relations office kind of. We deal with customers. We handle customers' complaints. We handle their inquiries. We interface with our clients. So that tells you that we have a lot of interface with our customers in NAFDAC. So when you were talking about complaints, basically it is in reforms unit because it's the clearinghouse. So when people want to ask questions, they want to find out why this and why that, they come to us. So we have Servicom unit, and also we have anti-corruption unit. Anti-corruption unit is a place where, of course, Madam has been gracious with us. Recently, she approved the constitution of anti-corruption transparency unit team. The team, we call it actual team, and it comprises of different people from different directorates. And basically what we do there is to look out for red flags. We try to prevent corruption. It's not just fighting it, we're trying to prevent it. Look at areas where there are vulnerabilities, areas where, okay, we can actually block all those loopholes so that people will not be corrupt. Let me use that word, staff will not be corrupt. So basically anti-corruption is talks about prevention purposes. That is what anti-corruption unit and anti-corruption team is basically, with other things that we do. And of course we have the gender sub-unit. Of course the issue of gender parity. We want to make sure that nobody is being molested, no harassment, and everybody is duly represented, both sexes and all that. So we have hotlines that are in the public domain that people have been calling. We receive calls every day in the office, questions, complaints, and also we have our email. The email is also in the public domain, is in our website, NAFDAC website. So if you don't want to call, you can go and write your complaints. It will get to us. And such complaints, we have our timelines for resolving them, which we try to keep up with. And also, we also have our customers that walk in. okay, you are in the neighborhood, and we had cases, oh, I came to register this, and the way I was attended to was not so nice, and they're told that there's a civic community, and you see them walking in, and we try to kind of, okay, let them know that, okay, this, and this is what you should do, because when we talk about complaints, you have your own part, and NAFDAC also has her own part. So far so good. We have been receiving complaints, and we've been trying to, you know, within our own, doing our own part. So once they send such complaints, immediately we respond to those complaints. And okay, we want to, but we need more information. Okay, you are telling us so and so is producing fake or substandard products somewhere, and you are not giving us enough information, the address. We need those address to work with, because once those information come to us, we look at the where the complaint is coming from, and we send it to our officers in those areas, in those states, for them to do the needful. They go immediately into investigation to see to it that, okay, this complaint is either true or not. Of course, there are some complaints that are not true, but by the time you do the investigation, we discover that this one is out of envy or jealousy, or you just want someone that you feel is doing well, you want to nip their product in the bud. You feel, why should you continue doing what you're doing and all that? So once we receive complaints, we ask them if the complaints are not well channeled, or the things they're supposed to submit, they are not, the information we need, they are not there. We respond to them. Thank you for sending this complaint, but we need more information. Some will not. And so when such things happen, after 30 days, we close those complaints because we don't have enough information to work with.
Across the geopolitical zones of the country, NAFDAC's decentralization initiative has made regulatory activities and indeed service delivery to its various stakeholders more effective and bespoke for the various localities. This has enabled the agency tackle challenges within its purview with a lot more precision. In the North Central, for example, the agency is tackling alcohol and indeed drug abuse with a bit more tact.
Drug abuse among the youth and even the elderly is rampant in the zone, no doubt about it. But the agency has currently put in place a lot of activities to reduce these incidents, especially during this it's a festive season. We've gone out to carry out sensitization program in schools, in marketplaces, and even among community leaders, sensitizing them. And we have also put out a lot of surveillance activities, mopping up these products wherever they are found. We have had stakeholders meeting with both the people that sell on retail and the supermarkets, the patent medicine stores, and even pharmacies to discourage and disabuse this activity of drug abuse in the states of the zone.
Despite the prevailing security challenges ravaging parts of the north of the country, officers of the agency still brave the odds to ensure that it delivers on its mandates of safeguarding the health of the nation.
It's a common problem everywhere. We know the level of insecurity in some parts of the Northwest. There are local governments we can't even go to. But apart from that, generally speaking, the management of NAFDAC has done very well in terms of providing the logistics, the vehicles. We've got quite a number that are brand new, and that has made operations reasonably better than it has been in the recent past.
The primary mandate of NAFDAC to ensure that only safe, quality and wholesome products are available for human consumption. So any product that deviates from these normal parameters, NAFDAC has the primary mandate to either seize it, or sometimes clients voluntarily submit such products to NAFDAC for destruction.
In this area, we have done a lot of enlightenment. We actually assist them, because now we encourage them to register, to apply electronically. We know the level of literacy. We know how our people can run into difficulties concerning this. And therefore, we have systems in the office where when they come, they are assisted to actually apply. But those of them that can apply online, on their own, it is a very, very simplified procedure, and we make sure no time is wasted unnecessarily. We have accomplished quite a lot in that regard.
NAFDAC and your else will be right back. Please stay tuned.
As part of NAFDAC concerted effort to prevent incessant food poisoning and to safeguard the health of the nation, the agency wishes to advise the general public to take the following precautionary measures in food handling. Chemicals are not food, so do not taste with your tongue. It is dangerous to health and it can kill. It is dangerous to cook your meat with paracetamol or any drug. It can damage your liver, kidneys, or other organs. Do not ripen your fruits with calcium carbide. It can cause cancer or damage the kidneys or liver. It is dangerous to use sniper to keep insects and other flies away from any food products. Cooking does not remove sniper. Do not consume any mixture or herbal preparation that do not have NAFDAC number. It could be deadly. Too much monosodium glutamate food seasoning that comes as cube or in sachet can be dangerous to your health. Do not add any chemical to food or drink to make it sour or improve taste. Safe food. Everyone's business. NAFDAC. Safeguarding the health of the nation.
Welcome back. If you are just joining in, you're watching NAFDAC and your else. In the Federal Capital Territory, the agency has a dedicated directorate, just as it does in Lagos, that focuses on the area and ensures that businesses, especially small and medium-scale businesses, remain compliant to safety standards.
The FCT, we carry out surveillance. Surveillance in the aspect of people manufacturing unregistered products, people selling unregistered products, people hawking drugs, including herbal medicines. Some hawk in vehicles. They put loudspeakers in vehicles to hawk herbal medicines. We go around, surveillance, do surveillance, and we arrest them, and we sanction them according to the agency's guidelines. Now, the products that are unregistered or fake products, we mop them up, we seize them. Some good-spirited Nigerians give us information about where they're making some of these products. So we go on to carry out our activities, enforcement activities. We close down those unregistered, those facilities where the products are not registered. Manufacturing unregistered products, we place them on hold, we close them down, and then we impose the administrative charge of the agency. We invite them to the office to initiate registration of those products if they want to continue to manufacture them. There is this company that is making fake hand sanitizer that we went to. Somewhere, in fact, is registered in some other states, and they moved to FCT, is making it in his house, and then by information, in fact, somebody came to report, give us information. You know, we cannot be everywhere, and we cannot know what is happening everywhere. So based on that, we were able to trace the house, and then got the sanitizers. We seized them, and then arrested the man producing the something and applied regulatory sanctions to them. There are also water producers that we have sanctioned in some areas of the Federal Capital Territory where we close them. And then we find out that some of them that you even close, after some time they go back to go and remove the hold label and then go to sneak in to do production. But we still get information because they are constantly monitored. We go back and also enforce our sanctions to close them down.
Beware. Fake or damaged drugs have put many people in serious health harms and have killed many others. But you can protect yourself by seeking professional healthcare advice when you feel unwell. Buy drugs from only licensed pharmaceutical outlets and make sure you check the packaging for poor condition, spelling errors, and unclear labelings. Also, check NAFDAC registration number, batch number, the expiry date, manufacture date, and manufacturer's address before paying, and always collect a receipt. If you suspect a drug to be fake or damaged, report immediately to NAFDAC on 0800-162-3322 or send an email to sf.alert@nafdac.gov.ng. Protect yourself and your loved ones. This message is brought to you by NAFDAC with support from WHO.
All over the country, the agency is working relentlessly to ensure the nation is rid of falsified, substandard, and unwholesome food, drugs, cosmetics, and medical equipment by monitoring to ensure and instill a culture of good manufacturing practice and other important practices that guarantees that consumers are sold quality and safe regulated products.
We have our trainings also that will give trainings we do for the MSMEs. We have them, we liaise with the Abuja Enterprise Agency that is there, which handles MSMEs in the FCT, and then also SMEDAN. We work together to ensure that we get to as many MSMEs as possible. And then also with religious organizations, we have them informing us, they have trainings for MSMEs, and then we go there, give them our guidelines, tell them what it takes to register the products, registration procedure, the cost of registration, and we equally train them on good manufacturing practice in manufacturing, what they need to do or to observe, the standards they need to observe for them to produce products that are of good quality. So it's a continuous thing we are doing.
We have also recorded a great success in the area of registering this micro-scale products, the MSME products. This year, we registered about 1,500 new products, both food and cosmetics in the zone, which is quite a great number above what we had in the previous years. So many more people are coming up to register their products, and some of them are even meeting up with renewal, which means they are sustaining their products in the market. So some of them have come up, those who registered in 2018, 2019, a number of them have come up to renew their license, which is a proof that the market is sustained. They are coping in the market. So it's a plus for us.
Here we have done a lot of enlightenment. We actually assist them because now we encourage them to register, to apply electronically. We know the level of literacy. We know how our people can run into difficulties concerning this. And therefore, we have systems in the office where when they come, they are assisted to actually apply. But those of them that can apply online on their own, it is a very, very simplified procedure, and we make sure no time is wasted unnecessarily. We have accomplished quite a lot in that regard.
Pre-COVID, we were going to the areas, you have agrochemical marketers, you will go out, you will go also even to the markets to sensitize them. So with this COVID area, most of the things have to be virtual. And so, because we were not going to gather crowd, we deal with the executives. We talk with the executives, discuss with the executive, give them our plans, and then they will go down and cascade, because some of them have them in various area councils, FCTs and area councils. They cascade them down to them in various area councils. So, and we're planning also for cosmetics manufacturers in the FCT sensitization. And then we're going to do a lot of routine monitoring. Routine monitoring, that is when companies have registered their products. Yeah, the onus lies on us to go back and see if they are maintaining the good manufacturing practice standards to ensure quality products. So we're going to do a lot of routine monitoring. And then also, we had done sensitization for master bakers before. We are going back to repeat. And for water producers, a lot of sensitization for our stakeholders. We're going to do a lot of monitoring And also, we are stepping up also our surveillance.
Time now for NAFDAC updates, a bulletin on NAFDAC's activities across the nation.
NAIP pays a courtesy visit to NAFDAC. The Association of Industrial Pharmacists of Nigeria, NAIP, paid a courtesy visit to the Director General of NAFDAC, Professor Mojisola Adeyeye, at NAFDAC head office in Lagos. Speaking at the meeting, the association president, pharmacist Ken Onwegbu, commended the efforts of Professor Adeyeye in the fight against substandard and unwholesome products in the country. He also declared that the relationship between the association and NAFDAC have yielded tremendous success in safeguarding the health of the nation. He also remarked on the activities of the association, which it has been able to carry out in a bid to foster good pharmaceutical practice in Nigeria. Professor Mojisola Adeyeye in turn appreciated the visit of the members of the association and assured them that NAFDAC will continue to do everything possible in improving pharmaceutical practices in the country. That's it on NAFDAC Update. You've been updated.
That's our package for today. Please join us same time, same station next week for a fresh edition. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers, our doors are always open. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700-162-3322. For complaints, call 0800-162-3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email, reforms@nafdac.gov.ng, or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded. COVID-19 is real. Please ensure you and your family follow safety measures as outlined by the NCDC. Stay away from crowded places as much as possible, and if you must be out there, please wear a face mask. Wash your hands regularly with soap and water, and ensure you use only NAFDAC-approved alcohol-based hand sanitizers. Taking the NAFDAC-approved COVID-19 vaccine is safe. It's our best bet of stamping out the deadly coronavirus. And don't forget to download the MedSafety app from iOS or Play Store to report any adverse reaction from the vaccine or any other medicine at all. See you next week. Stay safe.